There is some confusion in the Senate right now over health care. Republicans are expected to vote next week on whether to begin debate on a health care bill. The problem is they don't know which bill that is. For more now, we're going to turn to Jennifer Haberkorn, a health care reporter for Politico. So, Jennifer, John Cornyn, the Senate Majority Whip, was asked if lawmakers would know which bill that they would be voting on, and his response was curious. He said, "That's a luxury we don't have." I don't even really understand what that response means. Should it be a luxury to know ahead of time what bill to sort of research and how to conduct a debate?
Yeah, this is so unusual right now. I mean, Republicans are expected to vote on Tuesday on starting debate on Obamacare repeal, but they don't know what bill they're starting debate on. You know, there's several things kind of in circulation right now. They could vote on repeal only, taking away Obamacare and not replacing it with anything for 2 years. Or they could vote on what the Senate has been discussing, which is repeal and a lot of replace. Or they could be, voting on something else. This is such an unusual moment, and it really reflects how divided Republicans are. They don't really know if they can successfully start debate on Obamacare repeal. So this is going to be very high drama on Tuesday when they move to this vote.
Maybe they'll just discuss all the options, which, you're right, could make for a very heated debate. You spoke to Utah Senator Mike Lee. He's one of 4 Republicans who have been very outspoken about their opposition to the health care bill. And he's gotten a lot of pushback, a bit of flack. Why is he the one who's under fire?
A lot of other Republicans told us that they feel like he didn't want to get to yes on Obamacare repeal. He's one of the folks who argues that they should repeal the law as much as they can. A lot of other Republicans don't agree with that. They like some parts of the Affordable Care Act, want to keep them in place. Who's very much at the conservative end of the Republican Party right now. And, those Republicans feel like he was the one, or I should say one of several senators who really put the stake in the heart of this Senate Obamacare repeal effort. He pushed back on that, very, very forcefully, saying that he was elected to repeal Obamacare. There were 51 senators, 51 Republican senators who voted to repeal Obamacare 2 years ago when it was vetoed by President Obama. And he's questioning why those folks don't want to do that now. And, the answer to that, of course, is they're concerned about the blowback for people losing coverage. But it's really underscoring how divided Republicans are.
Yeah, very difficult to take something away from people once they've gotten used to it. Certainly the president has said several times and tweeted several times, look, we should probably just let Obamacare fail. He hasn't made any moves in that direction, but I'm wondering, is there anything the administration could do to weaken Obamacare, and what sort of impact would that have on consumers?
Absolutely. The administration has a lot of authority over how the Affordable Care Act moves forward. If you remember, one of the criticisms Republicans had of Obamacare was that there were so many secretary shall lines in the law, meaning the secretary had a lot of authority. Now that authority is in the hands of Tom Price, a Republican HHS secretary. The most significant thing that they could do right now is these cost-sharing reduction payments. This was a lawsuit the House brought against the Obama White House over a piece of the Affordable Care Act. It's basically $8 billion. And now the Trump administration can essentially take that money away at any moment. And it would really anger the insurance companies. Insurers say that it would drive up premiums and make the markets even more unstable. In fact, they say just the uncertainty around these payments right now has really risen premiums. So this is one of the most significant things the Trump administration can do, and they could do it very quickly. Kind of the sword of Damocles over this entire debate over the Affordable Care Act.
One of the things that we have heard from President Trump about whatever the replacement bill would look like is that he did not want to see any cuts to Medicare. So that's fine, but he is receiving a lot of pushback from more conservative members of his party. Sorry, Medicaid, not Medicare. He is receiving a lot of pushback from more conservative members of his party. What's their argument?
So they argue that the Medicaid program has grown out of control. It was started in the 60s for pregnant women, very poor people, and the elderly poor. Now, under the Affordable Care Act, it was expanded to adults without children who are very, very slightly over the federal poverty level. And so Republicans see this as their opportunity to rein Medicaid back in, to get it under control. They argue that if it's not under control, that it's not going to be around. You know, it's just going to grow out of control, and it won't be there as the safety net for the folks who really need it. So Republicans view this as their opportunity, and you know, if this law had actually moved forward, it would have been one of the most significant changes in there. But as of right now, of course, it looks like they're not going to be able to accomplish that.
Yeah, we don't know what they're going to be accomplishing come next week when they start some sort of debate. Jennifer Haberkorn, thank you so much.
Thank you.